What happens when the biopsy doesn't tell the whole story? And the benefits of joining the local pathology society, coming up next on the Path News Network. This is the Path News Network Daily Edition, powered by the College of American Pathologists. Today is Tuesday, August 5th. I'm Brittany Riddle. Here's the latest news. CAP members are calling on Congress to pass the Improving Seniors Timely Access to Care Act. The bipartisan bill would increase transparency and expand patient protections in Medicare Advantage insurance plans. CAP members can use our Action Alert Center to ask lawmakers to support the bill. Get there by clicking the link in the show notes. On the flip side, the CAP opposes the Ensuring Community Access to Pharmacist Services Act, citing patient safety concerns. The CAP co-signed a letter with the American Medical Association and other medical groups. It outlines concerns about compromised patient care if pharmacists were to perform services traditionally done by physicians. You can read the full letter in today's show notes. What should pathologists do with partial or limited sample and clinical information? Find out during an upcoming webinar, Clinching the Diagnosis, when the biopsy isn't the whole story, on August 12th at 1 p.m. Central Time, 2 p.m. Eastern Time. CAP experts will explain how to integrate clinical history, imaging, and pathology findings to manage ambiguous cases. Register today using the link in the show notes or visit cap.org. Finally today, membership in a local state pathology society has several benefits. Joining me to talk about it is Dr. Raul Benavidez, CAP member and president of the Texas Society of Pathologists. Tell us about the Texas Society of Pathologists and your partnership with the CAP.
The Texas Society of Pathologists is the professional society within the state of Texas where pathologists will have their annual meetings, network, engage in advocacy, and also support any legislative efforts and generally work together in a similar way that we would nationally with the CAP. So we function as kind of one of the regional, for the state of Texas, branches for the CAP, kind of working together at the state level and also the federal level.
You mentioned that you work with the CAP. For CAP members, tell us why it's also important to be a member of your local society and some of the benefits.
The changes you see as an individual are related to both federal and state changes. So there's state legislation. In fact, every year you see a publication of all the things that are coming live in certain states. So there are lots of things that we differ for you depending upon what state you're in. And that comes down to payment as well. So it's really important that we have this bi-directional partnership because, number one, we participate on a national level. We see our senators on a federal level, our representatives on a federal level. But there are also some changes that are propagated at the state level. So working with the CAP to understand what other states are doing, the resources they can bring, helping us with their advocacy, just like large state societies engage and have their own employed lobbyists and administrative staff that the CAP does as well. And so they work together to help you prep. And so whenever you do engage, either legislatures or even payers, so your payers treat you differently depending upon the state. So if you see a payment change in your state, it's good to engage with the CAP because that sometimes has been addressed in another state, and you can use that to your advantage, either with how you plan or to be able to present that to your state legislature, saying this is how it works properly in other states. So it's a lot of benefit to have not only the resources that CAP brings from a preparation standpoint, but to just understand what the rest of the nation is doing, because many times changes will move from state to state, just seeing where they can be successful.
So what are some of the advocacy wins that you've had so far this year or the legislative priorities that you've been focusing on in Texas?
A lot of that is going to be in concert with our medical society. So we live within the House of Medicine. For and that's AMA, TMA, American Medical Association and Texas Medical Association. So we partnered with them to fight some changes to how forensic cases are signed out when it related to toxicology. We're able to stop that. There were some changes to payment models that we were able to advocate against, and some things about other things about reporting that we were able to successfully talk to legislatures and have them understand exactly why the changes would be detrimental to patient care. So a lot of successes that we're able to do in concert with both the College of American Pathologists on the national level and TMA, our medical society, on the state level, and indirectly with the AMA, because all those resources come to bear together.
That sounds great. Thank you so much for joining me today. For members who are in Texas, tell us how they can get connected to the Texas Society of Pathologists.
So you can find us there. Just it's simple Google. We'll be at the very top. So you can follow that link. You can easily join. You can join us at our upcoming annual meeting, February. We'd love to see you there. We're also looking for people to get involved with various committees. So we'd love to hear from you who want to be engaged at a high level, either at a high level or individually within your practice, representing your needs of your practice and your area. And join us at the annual meeting so we can talk to you. And we're also looking for people to join our local House of Delegates. We have our own House of Delegates, and we really need members from various parts of the state. We're a big state.
That's all for today on the Path News Network Daily Edition, powered by the College of American Pathologists. Thank you again to my guest, Dr. Raul Benavides, for joining me. We're back tomorrow at 5 a.m. Eastern Time. Subscribe to this show on Apple, Spotify, or your favorite podcast platform. Get more news like this on Tuesdays and Thursdays with our membership newsletters. I'm Brittany Riddle. Thank you for listening.